Are you carrying around suitcase-sized bags under your eyes that you'd like to send packing on their own vacation? Well, it may be easier than you think. Lower eyelid bags and dark circles can make you look old and tired. The first step in trying to fix these is to figure out what's causing the problem. Sometimes it's a matter of pigment in the skin or broken blood vessels and veins. Sometimes it's just shadowing from the bag. To determine which one it is, I like to tell people to take 2 fingers, pull down their skin below their lower eyelid, and flatten out the bag. If that dark circle goes away, then it's not pigment in the skin and no cream is going to help. It's actually just shadowing. Many people think that it's something that they should correct with filler. And in fact, a lot of people put filler into that area. That's not the problem in the vast majority of cases. And actually, that filler is often able to be seen and felt because the skin is very thin and is stretching that very thin skin every time you do it. So it's less than an ideal solution. The real problem is the bagging or the protruding of the fat over that trough. That area is supposed to be hollow. If you look at most young people, there's a hollow there. And what happened is under the eyelid, there's a mattress of fat. When you run, even though the eyeball is in a bony eye socket, it doesn't jiggle up and down because the eyeball is bouncing on the bone as you run. What happens is there's a mattress of fat that's cushioning the eyeball from that bone underneath in the eye socket. And that mattress of fat goes all the way back to the back of the eye socket, which is much deeper than most people think. The eyeball, which is a round circle, then has a cone of muscles that go to the back, and it's quite a deep socket. That fat pad is held in place by a fibrous sheet called the orbital septum. Eyelid bagging is caused by 2 things. That fibrous sheet or the orbital septum can be weak. That allows the fat to pop out. There's also a ligament that helps hold up the eyeball called Lockwood's ligament. If Lockwood's ligament is weak, the eyeball falls down and causes the fat to pop out the front. If the orbital septum is weak, it doesn't hold back the fat and it pops out naturally. So a weak Lockwood's ligament or a weak orbital septum creates an eyelid bag. Some people are just unlucky, and when they're young, they have this problem. It's not necessarily related to age. In other people, though, as time goes on, the ligament gets weak, the eyeball falls down, the orbital septum gets weak, the fat pops out, and the eyelid bagging appears later in life. The way to correct that is not to tighten that ligament. You can't tighten that ligament because it would interfere with the movement of the eyeball. The way to solve the problem is to trim that fat back to the edge of the bone. Now, how much do you trim? Well, we know that if the fat sticks out past the edge of the bone, it's going to look bad. We also know that, like with any other cosmetic surgery, the surgery lasts about 1 second. And that's not a joke, it's really true. You're getting older the minute after we remove the extra fat. And so it's going to prolapse out again later. And in some people, I look at them a year later and they have a small amount of prolapse again and need another trim. That's rare. In other people, I did them 20 years ago and they still look like I did them yesterday. That's unusual. And everybody's somewhere in the middle. I'm asked about the average time to redo. In my experience, it's 7 to 10 years. But that begs the question, why don't you just remove a bunch of extra fat so it takes longer to pop out? And that would make a sunken eyeball. It would make a sunken eyelid, and it wouldn't look good. And so we don't do that. We remove the fat back to where it's going to create a natural look. There are 2 ways to approach lower eyelid surgery. If someone has a lot of extra skin on the outside, their lower lid is doubled over and hanging, you need to do an outside scar. That incision is just below the eyelashes, and it really is very hard to see after about 3 or 4 months. The skin heals very well in that area. But you need to remove a little bit of the extra skin so there is that small line on the outside beneath the eyelashes. Other people have eyelid baggings, but not a lot of extra skin. Then we can do the procedure entirely from the inside with no outside line at all. The lower lid is pulled down, a small incision is made in the mucosa behind, and the fat is trimmed through that inside incision, leaving no outside marks at all. I only use laser to do eye lift. I have not used a scalpel to do this procedure in many, many years, and I am not saying that I do laser resurfacing like a Fraxel or a CO2 laser resurfacing. This is actually using the laser as a scalpel. It's a CO2 laser with a special tip that actually cuts like a knife, but the advantage of that procedure is that you're sealing the blood vessels and the lymphatics as you cut. So there's minimal bruising, minimal swelling, and a much faster recovery. The procedure takes less than a half an hour. It's usually done with the person asleep, but asleep like a colonoscopy. A little bit of propofol, and you don't need to be intubated with a breathing machine and all that. People wake up very comfortably because they're numb at the end of the procedure. As soon as the person is asleep, I numb the area with a long-acting Novocaine, so the person wakes up totally comfortable and essentially says, "Can I go home now?" Takes their pain medicine from the recovery room every 3 hours for the first night. But this procedure tends to be very, very easy to go through, and there's minimal discomfort. By the next day, almost all people stop pain medicine altogether. So I hope that answers all your questions about lower eyelid blepharoplasty. And you can follow me here for more information, see my YouTube videos, and see my website at drstudin.com. I'm plastic surgeon Dr. Joel Studin.